All right, welcome back to ABA exam review and the continuation of our BCBA practice question series. We're going through the next set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Be sure to check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Hugo learned how to ask for a snack appropriately, but now asks for snacks throughout the day. Hugo, during an 8-hour period, will ask for 16 snacks. If you were to use non-contingent reinforcement to target Hugo asking for snacks, what should the NCR schedule look like? Now, when you're using non-contingent reinforcement, we need to first take data on the behavior of interest in order to appropriately plan our NCR schedule. So remember, everything we do is systematic. Nothing is by chance. Nothing is just randomly done. So we're systematically analyzing the behavior. In this case, we're looking at Hugo asking for a snack appropriately. After measuring the behavior, Hugo asked for snacks 16 times over an 8-hour period. If we make that into a rate, Hugo is asking for two snacks every hour. So we're going to use a non-contingent reinforcement, which ultimately provides or accomplishes the goal as an abolishing operation for either attention or, in this case, asking for snacks. We need that schedule to almost mirror or exactly mirror whatever the learner rate of responding is. So think about, if Hugo is asking for 2 snacks every hour, when should we provide non-contingent reinforcement to make it an abolishing operation? A, provide Hugo with 16 snacks per day. Does that accomplish anything as far as meeting Hugo where his current behavior stands? No. What if you provide him 16 snacks in an hour? Are you potentially just making the behavior worse? Of course. Right now, he's asking for snacks twice every hour. If I just give him 16 snacks without a plan, that doesn't do us much good. So he's asking for 16 snacks. Doesn't mean we need to give him 16 snacks just willy-nilly. Same thing with B. Provide Hugo with 15 snacks per day. Again, what does that accomplish relative to the time period, relative to the rate? Nothing. Non-contingent reinforcement is on a schedule. 16 snacks, 15 snacks, there is no schedule. That's a big issue. C, however, is matching Hugo's rate, which is a great place to start. We're meeting Hugo right at his current rate of behavior. We have an appropriate schedule where we can provide Hugo with the snacks without him asking, and then we can work backwards using this abolishing operation. So remember, non-contingent reinforcement operates on a schedule, and at first, you want to meet that learner where their behavior is currently at. D, provide Hugo snacks only when he asks less than 2 times per hour. Well, we're likely trying to get to that point where he's asking less than 2 times per hour, but we're not there yet. We're just starting this non-contingent reinforcement schedule. And so we want to start and meet Hugo where his behavior currently resides, which is asking for 2 snacks every hour. Jillian works with adults who have autism and who are all capable of giving their own consent. She is the behavior analyst for 5 different adults who all live in the same group home. All 5 adults want to improve their diets due to health concerns. Jillian has an intervention that utilizes a response cost procedure and a different intervention that uses non-contingent reinforcement. Both interventions are equally effective. How should Jillian decide which intervention is most appropriate? Now, that is a long question. That is a lot to think about. When you see a long question with long answer choices, don't get intimidated. On the exam, you're going to have plenty of time if you're fluent, and by answering easy questions quickly because of fluency, it's going to give you more breathing room on these type of questions. The last thing you want to do on a question like this, on any question really, is jump right to the answer choice. Let's understand first everything about the question. So we're looking at Jillian and what intervention, or how she should decide what intervention is most appropriate. So Jillian works with these adults and they can give their own consent. Important. She is the behavior analyst and they all live in the same group home and they want to improve their diets. She has an intervention that utilizes a response cost procedure. Now, stop there. You should be thinking about this. Response cost is punishment just by definition. So she has a punishment procedure, and then she has a non-contingent reinforcement procedure. So she has this punishment procedure and this reinforcement procedure. Both interventions are equally effective. Now, how should she decide which intervention is most appropriate? And be very careful here. Remember, these are adults who can give their own consent. So, what do we need to be sure to do, not with just adults, but with all of our clients, but especially consenting adults? They need to be involved in their treatment. We have all this information. Let's read A. She should use non-contingent reinforcement procedure to avoid punishment. Well, there's no real reason to avoid punishment. Be very careful about that. Yes, we want to be reinforcement focused, but we're not avoiding punishment. Punishment just works to decrease behavior. Punishment is not inherently bad. So just using reinforcement just to avoid punishment, given the information where they're equally effective and they're consenting adults, doesn't really make the most sense. B, she should use the response cost procedure to target reduction of bad dietary choices first. Well, there's no real justification to start with response cost if it's equally effective as reinforcement. If these weren't consenting adults and they could not consent or give their opinion, then you're likely going with the reinforcement. But B doesn't make any sense here. C, she should ask the clients what they would prefer using. Yes. What if they want the response cost? As clients get older, sometimes they prefer the punishment. Sometimes they think it's more effective than just the reinforcement. So, given everything else is equal, ask the client. Very simple. D, she should perform another assessment to determine the effectiveness of each intervention. Well, now that would be just wasting time and resources. She already knows each intervention, or both interventions, are equally effective. There's no reason to conduct another assessment. Given all else is equal, given that they're adults who can consent and give their opinion, she should ask the clients what they would prefer using. The maid service is conducting a training to improve the consistency of how beds are made by their employees. Whenever an employee makes a bed incorrectly during training, the lead trainer hands them the visual instructions and says, okay, now make the bed using these exact instructions 5 times. What type of procedure is likely being used? So let's think about this. It's a procedure question, and we have to identify the procedure being used. So we have a maid service training on making beds. When an employee makes a bed incorrectly, the lead trainer gives them instructions and says, make the bed using these instructions 5 times. So, put simply, they make the bed incorrectly, they do it wrong. They are then told to do it correctly 5 times. So, when we implement an intervention following the wrong response and we ask the learner to do the right response multiple times, what do we call that? See how we can get to the definition? See how we can translate what the question is asking into ABA terms? Once you get very fluent, you're going to start doing that automatically. It's like seeing the matrix. You're going to read this and you're going to immediately translate it to ABA terms. That's the secret. That's when you feel confident. So A, restitutional overcorrection. With restitutional overcorrection, we are repairing the environment and then repairing it to a state better than it was before. Not occurring here, right? They're not repairing the environment. What they're doing is B, positive practice. They're engaging in the correct response over and over and over and over again. Negative practice is the opposite. Negative practice would be when the employee makes the bed incorrectly, they're told to make it incorrectly 5 more times. Instead, the employee makes the bed incorrectly and they're told to make the bed correctly 5 times. And then D, a response cost. Well, a response cost is obviously removing or taking away a reinforcer in response to a behavior. Now, what's occurring here? The employee makes the bed incorrectly. They're then told to make the bed using the instructions, which are the correct instructions, 5 times in a row. So the type of procedure likely being used here is B, positive practice. A behavior analyst tells a parent that the target behavior is keeping hands to oneself. The behavior analyst asks the parent to take frequency data on this behavior to help develop a plan for this behavior. The parent asks how she should respond to the behavior, and the analyst tells her to not do anything different than she is currently doing and to just worry about taking the data. What type of data is likely being taken? So we're identifying the type of data. But what do we know so far? I always ask, what do we know? We have a target behavior, and the parent needs to take frequency data to help develop a plan. Now, immediately, we're developing a plan. We don't have a plan in place yet. So immediately, you need to start thinking, well, if we don't have a plan in place yet, what type of data are we likely taking? Even further, when the parent asks how she should respond to the behavior, the analyst says, don't do anything. Why would we tell a stakeholder to not do anything different than what she is currently doing? And what situation would we want to do that? Well, when we're developing a plan and when we're taking a baseline data. In baseline data, we want to get a sense of where the behavior is currently without any intervention. That way, we can formulate a plan with accurate current data. If the parent goes and starts to intervene while taking data, that data is no longer going to be as accurate as we would like. It isn't intervention data because we're not yet implementing the plan. We're developing the plan. And it's not maintenance data because maintenance data follows intervention. So if we haven't intervened, then we can't have maintenance data. The data likely being taken is a baseline. This is a good example of an easy question, and it follows some of those long questions. So you can see there's a give and take on the exam. You're going to get easy questions that you're going to feel are too easy. You need to trust your preparation, take advantage of those. That's going to save you time and energy for the longer and more difficult questions. The behavior technician observes a brand new behavior that they haven't seen before. The client engages in this behavior multiple times throughout the day. Technician reports the topography but tells the analyst that they hadn't thought about the function. Why is this a problem? Why is this an issue? What is the issue? Technician reported topography but didn't think about the function. The first thing you need to teach all your technicians that you're going to be supervising and training is when they see a behavior, new behavior, old behavior, when they think about behavior, the very first thing should be, what is the function? That has to be the first question they ask themselves. Why? Well, the problem here is the technician reported how the behavior looked. Does that matter if we don't know why it happened? Not really. So A, behaviors can have the same topography, but different functions. Sure, think about holding your hand up. It can be for a high five. It can be waving at somebody. It can be telling somebody to stop. It all looks the same, but functions very differently. So just knowing the topography, especially for a brand new behavior, doesn't really tell us much about why that behavior is occurring. B, the magnitude should be the first thing you consider when defining behavior. Of course not. Magnitude, in most cases, is going to come last if it comes at all. And then C, you cannot describe the topography of a behavior without knowing the function. It's not true, right? You can describe how a behavior looks even if you don't know why it's occurring. The topography is not that hard to identify because you just have to observe and write down how it looked and what happened. The function is harder to figure out, but the function is the more important piece. So even though it's just a hypothesis that this technician would be delivering, they still need to come prepared with, well, why do you think it occurred? Because the topography is not enough to help us understand what we need to know about this brand new behavior. Using exact count per interval, inter-observer agreement, calculate the IOA for the following data. So exact count per interval IOA is arguably the most precise type of IOA and the most strict IOA. And I would save IOA for last, and especially on our even on our study guide, we limited some of the IOA to what we thought was the most important, because once you look at them and learn them, then the name of each IOA kind of gives it away. And then additionally, it can get very mathy and you can get bogged down in it. All that said, let's just answer this question, but save IOA for last if you're not too familiar with it. So exact count per IOA, meaning we're going to look at exactly how many times our observers agreed. So interval 1, do we agree? 1 and 2? No. Interval 2, do we agree? 3 and 3? Yes. Interval 3, do we agree? No. So we agreed how many times? We agreed 1 out of 3 times. So simply divide that, and you're going to get 33% IOA, which is why exact count is so strict, because both observers need to agree completely on the data or else it doesn't count. So this IOA is not very good, 33%, not a great IOA, but that's the count we used, and so that's what we have to go with. Thank you for watching. Check out behavioranalyststudy.com for all of our study materials. Make sure you like and subscribe if you haven't. Let us know when you pass so we can include you in the Sunday shout out. Work hard, study hard. See you soon.